Now, from Southern Colorado's news leader, channels 5 and 30, this is News First at 6.
Of course, it is vacation time. A lot of people will be traveling this summer. Many will go overseas. So what is the risk for catching a contagious and potentially deadly disease? News First Nicole Vandeputty is live out at the Springs Airport with more on this. Nicole?
Well, Lisa, these two recent cases of tuberculosis certainly have people concerned about overseas travel. At least that's what they tell us over at Passport Health in Colorado Springs. They actually give immunizations and counseling to people who are planning on traveling overseas. And while they say there's not a lot that you can do to protect yourself against getting tuberculosis, they do recommend getting a TB test before and after you go to any countries where it's prevalent. That's places like Africa and Southeast Asia. They say people can actually have TB and not even know it. A lot of times your body is just going to fight it off. They also say it's not that easy to catch, but that doesn't mean there isn't a risk.
It's low risk, and it depends on the length of time that you're exposed to that person. Also, how close are you sitting to them? Are you sitting right next to them, and are you on that plane for over 8 hours?
And they say wearing a mask on a plane won't help much if you are next to someone who's sick. Their advice is if you see someone ill, ask a flight attendant to move them. Now, there are a lot of other potentially deadly diseases you can pick up from other countries. They recommend that if you do plan on traveling overseas, to talk about what diseases you would be at most at risk of getting. In some countries, certain vaccines are actually required before you go. They also recommend that if you are planning on traveling overseas, to get those vaccines about 4 to 6 weeks in advance. Gives them time to kick in. Lisa?
Good advice. Okay, thanks a lot, Nicole.